Good day, I am student nurse Hanilin. Today I'm going to perform a return demonstration in assessment of tracheostomy care. So for the materials needed, we need tracheostomy suction equipment, tracheostomy care kit or sterile supplies such as several cotton tip applicator, brush, 4x4 gauze pads, 2 basins, sterile pre-cut tracheostomy dressing, 2 sterile gloves, disposable inner cannula, the normal saline solution, the hydrogen peroxide, the roll of twill tape or Velcro tracheostomy holder, bandage scissors, towel or linen pad, overbed table, and face shield or mask. For the assessment, assess the patient's respiratory status including respiratory rate, depth and rhythm, breath sounds, color, and pulse oximeter results. For the rationale, it helps determine whether the patient can tolerate tracheostomy care. Next is to assess the tracheostomy site for drainage, redness, or swelling. So for the rationale, drainage, redness, or swelling may indicate infections. For implementation, identify the client. Good day, ma'am. I am your student nurse, Hanilin. May I know your name? How about your age po? Okay, thank you, ma'am. So, ma'am, today I'm going to perform tracheostomy care. So, is it okay with you, ma'am? Any question po? Okay, thank you. So, next is positions the client in semi-Fowler's position and place the towel or linen pad over the patient's chest. For the rationale, semi-Fowler's position promotes lung expansion and prevents back strain in the nurse performing the procedure. So a towel or linen pad prevents soiling of the patient gown. Next one is don sterile gloves, suction the tracheostomy tube, remove and discard the soiled tracheostomy dressing in the appropriate receptacle, and then remove and discard your gloves. For the rationale, suctioning clears the tracheostomy of secretion that could occlude the outer cannula after the inner cannula is removed for care. The next one is place the tracheostomy care equipment on the overbed table and prepare the equipment using sterile techniques. So pour the hydrogen peroxide into one of the sterile solution container and pour normal saline solution in the other one. For the rationale, it helps maintain sterility during tracheostomy care, so preparing the equipment before beginning care ensures efficiency. So the hydrogen peroxide is used to clean the inner cannula, faceplate, and tracheostomy site. So normal saline solution is used to rinse the inner cannula, faceplate, and tracheostomy site after they are cleaned with hydrogen peroxide. So next is open 3 4x4 gauze packages. So wet the gauze in one package with hydrogen peroxide, and then the next one is for the normal saline solution, and the third one is keep it dry. So next is open two cotton tip applicator. So same as the gauze packages. So wet the applicator in one package with normal saline solution and the other one is for hydrogen peroxide. For the rationale, you will use the third package of gauze to dry the skin around the tracheostomy site after cleaning. Then, prepares the applicators for cleaning the exposed surface of the outer cannula and the stoma site located under the faceplate of the tracheostomy tube, respectively. Next, open the package containing new disposable inner cannula. Then open the package of Velcro tracheostomy size or cut a length of twill tape long enough to go around the patient's neck 2 times. So make sure that to cut end of the tape on an angle. So next is done sterile glove. So keep the glove on your dominant hand sterile. So handle the sterile supplies with your dominant hand only. For the rationale, this is to maintain aseptic technique of the procedure. So with your non-dominant hand, remove the oxygen source if the patient has been receiving supplement oxygen. So for the rationale of this, so non-dominant hand touches only unsterile things or equipment. So unlock and remove the inner cannula with your non-dominant hand. So if disposable inner cannula was in place, so dispose the inner cannula in the biohazard receptacle accordingly to agency policy. So this is to prevent contamination by bacteria contained in the inner cannula. So if our usable inner cannula was used, place the inner cannula into the basin filled with hydrogen peroxide. So this hydrogen peroxide helps loosen tenacious secretions. Next is attach the oxygen source to the outer cannula. So this is to prevent oxygen desaturations in the patients during the procedures. So next is care for the inner cannula. Pick the reusable inner cannula from the container of hydrogen peroxide and scrub it with the sterile nylon brush. So this is to be used with your dominant hand. So for the rationale of this is to cleanse the inner cannula of secretions. Next is immerse the inner cannula in the container of sterile normal saline solution and agitate it until it is rinsed thoroughly. So for the rationale of this, immersing the inner cannula in normal saline solution and agitating it removes the hydrogen peroxide, so which can cause tissue irritation and debris from the inner cannula. Then tap the inner cannula against the side of the container. So tapping the inner cannula against the side of the container removes the excess fluid so that the patient does not aspirate it when you reinsert the cannula. So next is remove the oxygen source using your non-dominant hand. So reinsert the inner cannula into the patient's tracheostomy in the direction of the curvature. So the following manufacturer instruction, lock the inner cannula in place securely. So for the rationale, we need to remember to keep dominant hand sterile. So lock the inner cannula in place securely to prevent it from dislodging. So next is reattach the oxygen source if indicated. So this is to provide the patients with needed oxygen and prevents oxygen desaturation. So next is to clean the stoma under the faceplate with the cotton tip applicator saturated with hydrogen peroxide. So I'm using a circular motion from the stoma site outward. So use each applicator only once. And then discard it. So this is to prevent contaminations of the clean area. Then clean the top surface of the faceplate and the skin around it with the gauze pads saturated with hydrogen peroxide. So use each gauze pad only once and then discard it. So for the rationale, remove secretions to provide a prime medium for microorganisms growth, so to prevent contaminations of clean area. Next is to repeat 13 and 14 using the cotton tip applicator and gauze pads saturated with normal saline solution. So this is to remove the hydrogen peroxide and debris that can irritate the skin. So next, dry the skin and outer cannula surfaces by patting them lightly with the remaining dry gauze pad. So this can help prevent skin breakdown and removes moisture, which can promote bacterial growth around the stoma site. So next, seek assistance from another staff member to help with changing the tracheostomy stabilizer. So this is to prevent accidental dislodging should the patient begin coughing during the procedure. So next is remove soiled tracheostomy stabilizers. So in removing a soiled Velcro tracheostomy holder, with the assistant stabilizing the tracheostomy tube, disengage the Velcro on both sides of the soiled holder, and remove gently from the eyes of the faceplate. So for the rationale of this, removing the soiled holder promotes hygiene and prevents the spread of infection. If you are using twill tape, so removing soiled twill tape tracheostomy ties. So with the assistant stabilizing the tracheostomy size using bandage scissors. So avoid cutting the tube of the tracheostomy balloon. So remove the ties gently from the eyes of the faceplate and discard them in the nearest biohazard receptacle. So for the rationale, tracheostomy balloon helps stabilize the tracheostomy in the trachea and prevents an air leak. So cutting the tube to the balloon prevents the balloon from the holding air. So next, have the patient flex his neck and apply new tracheostomy stabilizer. So using a Velcro tracheostomy holder and fasten the Velcro. Thread one end of the tracheostomy holder through the eyelet of the faceplate and fasten the Velcro. So next is bring the holder around the back of the patient's neck, then thread the remaining end of the tracheostomy holder through the empty eyelet of the faceplate and fasten the Velcro, making sure that the holder fits securely. So then place one finger under the holder. So make sure that the holder is securing the tracheostomy effectively but isn't too tight. So for the rationale of this, so flexing the neck provides the same neck circumference as when the patient coughs and thus helps prevent you from placing the tracheostomy stabilizer in such a way that they would be excessively tight. So if you are using twill tape, thread one end of the twill tape into one of the eyelets on the tracheostomy facelet. So continue to thread twill tape through the eyelet, bringing both ends of the tape together. Bring both ends of the twill tape patient's neck. So then thread the end of the twill tape that is closest to the patient's neck through the back of the eyelet on the faceplate. Then have your assistant place one finger under the twill tape while you tie the two ends together in a square knot. So this is securing the tracheostomy too tightly might place pressure on the jugular vein, so interfere with coughing or cause necrosis at the tracheostomy insertion site. Then insert a pre-cut sterile tracheostomy dressing under the faceplate and new tracheostomy stabilizers, or fold a 4x4 gauze into a V shape. So the new dressing absorbs secretions and prevents skin breakdown under the faceplate. So last, dispose of the used equipment in the appropriate biohazard receptacle according to agency policy. So for the rationale of this, properly disposing of used equipment prevents cross-contamination. So for the evaluation, assess the area around the stoma site for signs of skin breakdown. Evaluate the patient's tolerance of the procedure. Then note whether there were any signs of respiratory distress. For the documentation, document the date and time that you performed tracheostomy care. Note the color, amount, consistency, and odor of secretions. Note the conditions of the stoma and skin around the stoma site. Note the presence of drainage, redness, or swelling. Then document respiratory status, including respiratory rate, depth and pattern, skin color, and breathe sounds. So note the patient's tolerance of the procedure. So if problems arose, document any interventions that were necessary.